right, good morning, Miss Waring. How are you?
I'm doing well.
6 weeks out from a knee replacement, is that correct?
That's correct.
How's your knee been doing?
It's been doing great. I feel like my old self. No pain, some swelling, but really good mobility.
Good. I see you're getting around without a cane or walker.
Oh yeah, ever since 2 weeks after surgery, didn't need either one really.
That's great. And are you driving now?
Yep, been driving for about a month. The first 2 weeks didn't drive at all. Was careful not to do that, to have someone take me. But after that, the trip is only about 10 minutes from my house, so it was easy to come and go from rehab.
Great. And are you taking pain medicine now?
Just Tylenol, extra strength Tylenol, a couple of those twice a day, just routinely.
That's great. After surgery, did you have to take strong pain medicine?
I took tramadol, especially that first week as it was required on the chart of medications. But after that, just sporadically, mostly at night to help me sleep better.
That's great. So Tylenol and tramadol is mostly all you needed. You weren't taking any oxycodone?
Never took one oxycodone.
That's super.
All right.